Hi, I'm Louise Marshall. I'm a Senior Public Health Fellow at the Health Foundation and a Public Health Specialist registered with the UKPHR. Just to say, I had a few problems with my sound in the last session, so I hope you are all hearing me okay, and please let me know if there's any problems. I'll try and keep half an eye on the chat, but also I'll leave some time for questions at the end. So feel free to chat away in the chat box. But if you have any questions that you'd like me to address at the end, then please put them in the Q&A box, which is, I think if your screen looks like mine, just at the top alongside that. So I will start with a bit about the Health Foundation for those that don't know us. We are an independent charity committed to bringing about better health and healthcare for people in the UK. We're the second largest foundation in the UK focusing on health, and we spend around 37 million a year on improving health and healthcare. The part of the organisation I sit in, the Healthy Lives team, our aim is to change the conversation to focus on health as an asset rather than ill health being a burden, and to promote policies and encourage local action that improves opportunities for a healthy life in the UK. Our focus in the Healthy Lives team is on the wider determinants of health and inequalities. And through the work I'll talk about, we were interested in how we can engage people to understand the issues, hopefully leading to them expecting government and others to drive change on the wider determinants. Moving on. So there's compelling evidence about the role of the wider determinants of health. And for the past few years, I think we've had a really clear story to tell about the aspects of our lives that will influence our health and how long we live, from our jobs to our homes, our access to education and public transport, to whether we experience poverty or racism. But this story about the wider determinants of health struggled to get cut through in the public media and political debate. People's attention too quickly turned to what individuals should do in terms of their behaviours and what the National Health Service could do, rather than thinking about prevention. So at the Health Foundation, we decided we needed to frame health communications differently, to tell a more powerful story, a story that could increase understanding of the role of the wider determinants of health and build support for policies needed to reduce health inequalities and improve health across the country. So we commissioned frameworks to help us understand how people think about health and to develop new ways of talking about the wider determinants of health and inequalities. So before I move on to the detail and to get you all engaged with pressing something on your screen, I'm really interested to know if people here today have ever found it hard to convey messages about health. And hopefully a poll should appear on your screens. There we go, thank you. And really interested for you to share any further thoughts or examples of this in the chat box as well. So I think if your screen looks like mine, you should have a little yes/no voting button. Yep, everyone answering so far has said they have had challenges, and someone who hasn't, which is great. So there we go. But yeah, 9 out of 10 saying they have found it challenging in the past. So I will just move on to the next slide. So over the remainder of this session, I'll take you through the findings of the research with frameworks and the recommendations, which we've recently published together with a communications toolkit. But before I do move on to that, one more question for you. I just wanted to ask if anyone has already used this toolkit or seen it or used it in talking about health. You should have another yes or no option pop up on the screen and you can vote. And really interested to hear about anyone's experiences who might have done so. Oh, we have got some people who are saying yes, they have. So really pleased about that. And yeah, please do share any experiences in the chat box, or I'd love to hear from you at the end. So yeah, a few people who have, that's great, but the majority who haven't. So okay, moving on. the project and what we did. The project with frameworks was undertaken in 2 phases. So phase 1 was to learn about how people in the UK think about health. And then phase 2, which was to develop and test new ways of communicating about health. The pandemic hit in the middle of phase 2 and was clearly and understandably dominant in all of our thinking about health and about everything, really. So we paused the research for some time, and then Frameworks undertook some additional research to check the continued and ongoing relevance of the work to that point and whether it was appropriate to continue and at what point. Across the phases of this work, Frameworks undertook both qualitative and quantitative research that included on-the-street interviews, experimental surveys, peer discourse sessions, and in total more than 7,500 people from across the UK were included in this research. Someone has just put in the chat that they'd be keen to see the toolkit. Right on cue, as Lauren has kindly put in the link that I've included on the slide there. So that's a link to our project page on the Health Foundation website. That includes the research reports, which is the full detail of what we did and all of the findings of both phases, but it's also got a link to our toolkit, and I'll share an image of that later on so you can see what bit you're looking for. If you can't find it, I'm sharing my email address on the last slide, so please feel free to drop me an email. But thank you, Lauren, for copying that link into the chat. So firstly then, just a word about framing and what it is and why it's important. So framing is the choices we make about what we say, how we say it, and equally importantly, what we don't say. These choices about the way in which a communication is framed shapes how we interpret and respond to the information provided. So when new frames enter public discourse, they can shift how people make sense of an issue, how they understand it, how they decide who's responsible for addressing problems, and what kind of solutions they might support. So in this way, frames can be a really critical part of social change. As I had a few technical problems with this platform in the test sessions, I decided not to attempt to share videos, but recordings of some of the on-the-street interviews that Frameworks carried out reveal really clearly how people's answers about their views and thoughts can differ in really quite significant ways when questions are asked differently. People can understand concepts through multiple mental models, and framing can help them access and express these different ways of understanding that might be wider than the kind of dominant model that they hold. And it's useful to note here, before I move on to the findings, that framing isn't just about using set phrases. So in our toolkit, we provide some examples of how to say things, but it's not just about using set phrases. The frames can, and indeed they really should, be adapted to the context, to the audience, the tone, and your own personal style, just as any communication should be. To see having some digital interference. I'm hoping other people can hear me okay. I haven't seen any problems in the chat, but I know there are a few problems in the previous session, so hopefully I am loud and clear. But I have put quite a lot of detail on the slides, so hopefully if you do have any problems hearing, you can see the key points on the slides. And I'm really happy that the slides are circulated as well, so that's absolutely fine. So just on to the findings of the research. So these are just really what for me were the key points from the first stage of understanding how people think about health and what makes them healthy. So in phase 1, key findings of the research were that when people think about health and what makes people healthy, they overwhelmingly think about individuals' behaviours. They think about people making better choices, and they think about people's willpower, and they also think about healthcare and a sort of medical model of health and illness, and health being a kind of absence of disease. And these ways of thinking, so also did some analysis of media narratives, and these ways of thinking also dominated these media narratives about health. So while the media obviously reflects public ways of thinking, it also has an important role to play in in shaping these, and what we found was that the media narratives were really tending to reinforce these individualistic ways of thinking about health. So I will go on to the recommendations for communicating. As I said, there's quite a bit of info here because I'm very happy that they're circulated and used as a kind of summary of a quite long research report on our website and Framework's websites, but also the toolkit I think you'll find will be a much more accessible way into the recommendations and ways to use them. So in a nutshell, these are the key recommendations. So number one, to state clearly why this is such an important issue. I'll go through these in a bit more detail, but state why it's important. Secondly, you need to explain to help people understand how the wider determinants influence health, as well as that they do. We need to be clear about some of the ways in which this happens. Thirdly, we need to get to a solution. And finally, there are certain key issues that frameworks have explored in the research that I'll go through in a bit more detail at the end. So moving on to number one, and starting with showing why this is such an important issue. So we really clearly need to state the issue and what's at stake. Over the course of the research, frameworks tested several different framings for communications, but the one that was most effective, and that's effective across different audiences that it was tested with, was about life expectancy. So what does this look like? It could look like a really clear opening statement that in some parts of the country, people are dying years earlier than in other parts, and then connect that with social and economic conditions that are cutting lives short. Couple of important things to note. Although I said one of the frames they tested was about life expectancy, we should avoid using too many of the sort of jargony terms that we can often use in public health. So avoid adding complexity with concepts like disability-free life expectancy or healthy life expectancy. Most people don't have a clear sense of what they refer to. And as a result, if we use them without really clearly and simply defining them, it's likely just to kind of create noise that will make it harder to get our key points across. And then another really important point to note is that data and statistics should be situated within a broader narrative. You can't expect facts and figures to speak for themselves, and on its own, data showing gaps in life expectancy doesn't shift how people think and reason. People will often see data, and if it's not in a very clear narrative, if it's not framed in an appropriate way, then people interpret it through their own lens. So they apply their own mental models and their own understandings about health and what affects our health to interpret that data. So just situate that data really clearly in your narrative. And on to the next recommendation. So explanation. We need to explain. Without this, again, people will just fill in the gaps, and they'll often come back to that narrative that people need to make better choices. And there are several effective ways that we can do this. So firstly, we can use metaphors. So a building blocks metaphor works well. So frameworks tested several different metaphors. They talked about building blocks and foundations and fabric and all sorts of things, but strong building blocks was the most effective at helping people's understanding of the role of the wider determinants. So we can focus on the need for strong building blocks to create good health and well-being in society. We can use that metaphor to explain the ways in which, when the wider determinants are firmly in place, they interact with one another to give the population stability in their lives. They empower them to have a voice in what happens, and they can build resilience to circumstances that are outside of individuals' control. We can also explain existing inequalities in health outcomes with that image of building blocks that have become weak and need replacing, so that everyone can benefit from that whole structure of society. And then second, in explanation, we can go deeper into explanation. We can take one or two determinants as an example and explain in a very stepwise way how they can influence health. Jobs and housing were found to be useful ones to explain, And in the toolkit, there's some examples of what that might look like and how you can communicate that. In addition, bringing chronic stress into the explanation was found to be helpful. So chronic stress and talking about the physical effects of chronic stress was found to be helpful in helping people to move away from the individualistic choice narrative. And again, there's some examples of how you can do that in the toolkit. And then the third recommendation is about showing that change is possible. So we need to avoid fatalism by showing that change is possible. Without doing that, people can feel quite fatalistic about the possibility of change. You've kind of set out the issues and then they worry that it's all just too hard to fix. So we've made our explanations, and we need to pair those explanations of how the wider determinants of health shape health outcomes with a message that we can fix it, and give some concrete examples of how that avoid going into too long a list of policy solutions. Instead, you can focus on one or two examples of the types of solutions that are needed to improve health. Then, as I mentioned, frameworks explored the effect and role of talking about several key issues that were dominant in people's minds at the time. So one of which is the NHS, particularly dominant at the time. This was during the pandemic, but also just any time you talk about health, it's forefront of people's minds. Also, some thinking about talking about racism and discrimination. So at the time of the research was the George Floyd murder and the Black Lives Matter movement. And so frameworks did some really interesting research looking at talking about racism and discrimination and racial inequalities in health. And then thirdly, the pandemic. So firstly here, the NHS. So one of the frames they tested was that we need to act on the wider determinants to save the NHS. Now that was not effective in increasing support for action on the wider determinants. And in some cases it could actually reduce support. So we might often say, we need to do this and that to prevent illness to save the NHS money. So that was not an effective way of making the case for support. But that's not to say don't talk about the NHS, clearly. We should remind people that the NHS was never meant to go it alone and care for people's health all by itself. And you can focus on the idea that it was always intended to be part of a much larger system that also supported people's jobs, housing, education, public transport, and so on. And then talking about racism and discrimination. So the research found that people of all races think about racism primarily as an interpersonal issue rather than a systemic or a structural issue. So when we're talking about this, we need to situate data and statistics about health-related racial inequalities within a broader narrative. We can't expect those facts and figures about race and health to speak for themselves and convey meaning, and we should avoid using unframed data about racial health inequalities. The frames and the recommendations that I've presented can all be used to contextualise data and tell a clear and consistent story that embeds that explanation about racism and discrimination within the broader story of the wider determinants of health. So you could lead with a broader argument about life expectancy and the role of the wider determinants. You can explain that racism and discrimination make life even harder for some groups, and conclude with the need to deal with the social and economic conditions that harm health and cut life short in the first place, and the need to rid our system of the racism and discrimination that harm health and life expectancy of people who experience racism even more. Because people have this dominant interpersonal view of what racism is, they think of people shouting at footballers and very interpersonal abuse first and foremost when they think about racism. You should avoid calling out policies and institutions as racist without explaining what you mean by it. You can't assume that the public shares an understanding of what racism is and how it works and the systemic and structural nature of it. And this all works because when we position racism and discrimination as kind of amplifiers of wider issues that affect other people in the UK to a certain degree, instead of presenting it as an isolated issue, people become more receptive to the messages, was what was found. It preempts some pushback of the kind of "but what about me" type of response, and prevents people from getting stuck in that mindset. And then again, you can talk about chronic stress. So when we provide a deep dive explanation of some of the ways in which chronic stress due to racism and discrimination shapes health, then we help to counter some of the individualistic and racist and classist assumptions about what shapes inequalities in health outcomes more specifically. The strategy is particularly effective to get people thinking about the role of racism and discrimination in shaping health outcomes and life expectancy. And then finally on to COVID and talking about the pandemic. So as I mentioned, the research was carried out over the pandemic. We paused for a while and then carried out some additional research to determine if there had been a kind of long-standing shift in understandings of health, and whether it was appropriate to continue with the research and when. So when we did, there was some additional work that looked at bringing the pandemic into communications. And this found that we should avoid leading with this. So there was a sense of fatigue on the topic, really, I think, but also that it could cue individualistic thinking. We can, however, talk about the entrenched inequalities and how the pandemic has exacerbated pre-existing inequalities, as well as introducing new ones. So what next? So what next? We've produced a toolkit, as I mentioned. This is what it looks like. And that's based on those recommendations for communicating about health and inequalities. So we published this earlier in the summer, and together with a series of short videos that Frameworks recorded for us about the recommendations. So they're also on our website. We also recently, a couple of weeks ago, held a webinar, and that included a presentation from Frameworks about the research, but also, and it's got those video clips that I mentioned from the on-the-street interviews that show really nicely how people's responses can change as part of their presentation. And there's also some discussion with public health professionals working at national and local levels who have had some experience of implementing the recommendations in their communications, so they reflect on some of that. The recording of that is also online at the link that Lauren shared earlier in the chat. If you can't find any of this, as I mentioned, do please drop me an email. Moving forward, though, we're really keen to support people to use the work, and we also want to learn about what impact it has. So we're really keen to hear about your experiences of doing so. As I said, please do get in touch. Let me know how you get on if you try it out, whether you find the toolkit useful, whether they lead to any different responses to your communications, and importantly, anything that you find challenging. And this is hopefully just the start in building a better understanding about the wider determinants and support for solutions. So I think that probably brings me to one more point actually. So I should say we're hoping very soon to have on our website, Frameworks have worked with a number of other organisations. They work a lot in the US, but they've worked with a number of other organisations, foundations and others in the UK about social issues, and many that cover some of the wider determinants of health. So we've asked them to sort of collate a bit of a summary of their recommendations and links to other toolkits, and hopefully that will be on our website very soon. So for example, they've done some work on housing, they've done some work on childhood obesity and framing in all of these areas, and just one here that feels particularly relevant at the moment in the cost of living crisis is talking about poverty, and this is the link to the work that Frameworks and Joseph Rowntree Foundation did on talking about poverty. So I should just move on from that, and again, coming to finish. So there's my email address. If anyone would like to get in touch, please do drop me an email. And thank you so much for joining this session. I'm really happy to take questions or to hear from anyone who would like to share experiences that they've had in talking about health or trying different ways of doing things. I think there is the Q&A box for questions, but do sort of continue to share any thoughts in the chat box. But I'm just going to navigate to the Q&A box and see if there are any questions there. None yet, but please do add any questions in there as anything occurs to you. It's kind of that point in the day, isn't it, when everyone's reaching probably a bit of a mid-afternoon slump and is ready for another break. If there are no questions, we can always just... is the toolkit available in different formats or languages, etc.? So, really good question. So I will deal with formats first. So it's on our website as a PowerPoint, as a PDF, sorry, that you can download. But we are also creating some PowerPoints that people can, use, or they can cut bits out of the toolkit to put onto slides. So we're really keen that you use it as you find useful. I think the toolkit is at that kind of, it's a PDF, but it's a kind of PowerPoint orientation. So it's very easy to lift bits of it into a presentation if you'd like to use it like that. We did quite a bit of market research in determining what format to create the toolkit in, and overwhelmingly people wanted something they could download. I know some of the other organisations I mentioned have done quite interactive toolkits, but people were kind of less keen on that, I think. But yeah, we're really keen to hear thoughts you have. In terms of languages, no, it's only available in English, and also obviously recognising different languages in the UK. But I should just say, and it's made me think that this was all developed in a UK context and culture in the UK. So frameworks will say that they've worked in a number of different countries, and it's not necessarily the case that bits of research they do in one country is applicable to another. So we would have to be careful using some of the research they've done in the US, for example, because there are different cultural models and mindsets, and recognising there's diversity of that within any country, but there's sort of not sure how transferable all of the work is, but it is only available in English. But very keen to hear from anyone who would find it useful in any particular other language. Then thank you. Some more questions. So is there any training being offered by the Health Foundation to help apply and implement the approach? Really good question. We are very keen to understand and to support people to apply and implement the approach. In terms of follow-on work, we are talking to frameworks about some work to understand better implementation, and hopefully work with some people working at local and national level in public health bodies to help them implement the approach and understand that process of implementation. So I think we can't, beyond doing webinars and things and providing the toolkit, which I hope when you look at it you find it quite user-friendly and quite implementable, but yeah, we can't work with frameworks in every authority across the UK to look at kind of applying the framing to documents, for example, or communications. But with the work we are hoping to do, it's very much that application and implementation that we want to learn about, and then share almost a bit more detail about the process of implementation. So this is something we're really keen to support, recognise we can't do it on an individual level with say every local authority in the country, but we are hoping to be able to share in due course, once we've done this work looking at implementation and importantly some evaluation of the implementation, to be able to share more of a guide to doing that in different settings. So what were the demographics of the people that informed the research study and creation of the toolkit? Wondering how reflective it is of diverse and different populations. So I don't have the complete breakdown in front of me, but it was a very large sample and representative of the UK population, and frameworks have looked at it by different cuts, and so they ensured it was sort of representative by many different ways, and they've even looked at it by kind of voting and things like that, and seeing if the recommendations work with people who have different voting views. So yeah, reflective and representative among the kind of 7,500 people that were involved in one way or another throughout the research. Did our research specifically look at framing public health messaging to other communities, people who are not British or who do not identify themselves as British? So no, we have got, I spoke a bit before about culture and transferability, and obviously there is that huge diversity of cultures in the UK, and we were only able to get to the point of sort of identifying one toolkit rather than kind of specifics and get into the detail of what works with different groups. But yeah, I think what we would say is it's sort of relevant in a UK context, but bear in mind that very different sort of cultural models stand, and to use your judgment. And we're just really keen to hear if there's anything that you feel really doesn't work with any certain groups. But yeah, the research was carried out among a very broad and representative group of people. Would be useful to look at reframing to include diverse communities. Yeah, and I'm really keen to hear as well, or to understand if there are specific groups, as I said, that you feel that this wouldn't work well with. Yeah, it is the nature of trying to get, so it's a part of it, I think, is trying to come out with some recommendations and framing that can be used broadly and consistently, because actually one of the things with communications is if people are hearing things repeatedly in the same way, and ideally if this is being used by different organisations and more widely, we'll start to get with some more consistent framing of our messages that will help the public as a whole to understand and help create that demand for action and support for policy action. But yeah, we weren't able to look at kind of specific toolkits or recommendations for very different communities, I'm afraid. I think we're probably at the end of the questions, and looking at the clock, I think we're nearly at the end of the session. Just checking I haven't missed any questions. No, I think I have answered them all. Please, as I said, do get in touch, share any experience, share any thoughts, and even if you just can't find the toolkit, do drop me an email and I can share a link. But otherwise, if there are no other questions, a huge thank you again for joining me today, and I hope you found it useful, and enjoy the rest of your day.